Hello and welcome to my channel, guys. I am Dr. Aparajita Roy and today we will discuss a very important topic, the top 3 reasons why candidates fail PACES. PACES can be a very difficult exam if you do not follow the right strategies from the very beginning. Even experienced clinicians with years of clinical practice may find it difficult to pass PACES. In my experience, the top 3 reasons why candidates fail PACES are preparation, confidence and luck. Let's talk about preparation first. If you're an international graduate and have never done exams like OSCE or USMLE, you will struggle to pass PACES in your first attempt if you do not have a rock-solid strategy. You may be a brilliant clinician, but you have to go beyond your clinical skills in order to pass PACES. So, when it comes to preparation, the number one thing that you should do is to understand the PACES mark sheet very well. In order to pass PACES, you have to satisfactorily pass 7 clinical skills across 5 stations. Which means that even if you are unable to perform well in one station, you may be able to gain those marks in a different station. However, if you consistently underperform in a particular skill and you are unable to demonstrate to the examiner what he expects, then you will not be able to pass that particular skill. And overall, at the end of these 5 stations, you may fail in that one particular skill. Also, apart from passing individual skills, you have to score a total of at least 130 marks in total 172 marks. So pro tip number 1, before appearing for your PACES exam, you have to know the PACES mark sheet like the back of your hand. It is only then you will be able to play up to your strengths. Now, the next important point that you have to keep in mind when you're preparing for PACES is emphasizing on the talking stations. As an international medical graduate, you may have heard that the communication station is extremely difficult to pass and you may be already working extra hard for it. However, of late, the history stations has also become extremely difficult to pass and the difficulty level is almost at par, if not more, than the communication station. The RCP has completely phased out tried and tested history station topics like TIA or chest pain, as these topics are often taught in courses and any candidate can memorize all those points and pass the station. The RCP wants to test whether the candidate can think on their feet when faced with a completely new topic in the history station in a high pressure situation and know how to navigate the conversation with the surrogate and come up with a plan. The recent exams have featured lots and lots of novel topics that can completely catch you off guard if you're not well prepared. So, pro tip number 2, do not take the history station lightly. So speak to your peers who have taken the exam recently and discuss with them how did their history station go. The next most important skill that you have to prepare well for is the physical science. Candidates, irrespective of the exam center, find it often difficult to pass this skill. Remember, it is not only important to pick up the right physical science, but also it is extremely important not to mention a sign that is not there. If you make this cardinal sin, mark my words, the examiners will slaughter you. You will not be able to pass this clinical skill. Make your examination technique look really slick. This will only come with practice. Another important tip that I learned from my PACES courses in the UK and that is not often discussed in the Indian courses is how to present your findings. It is extremely important to present your findings well in a concise and summarized manner to your examiner. As soon as you finish your physical examination, you turn towards your examiner and inevitably the first question that you will face is, please can you present your findings? So remember, this is your first chance to make a good impression on your examiner. So during your preparation, spend adequate time on your presentation skills. Again, like I said, this is something I have picked up during my UK courses and in my time in the NHS. The NHS consultants give a lot of attention to your presentation skills. Let me know in the comment section below whether you struggle with your presentation skills, and I will be happy to make a separate video on PACES presentation skills in my channel. So, pro tip number 3, practice, 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 as practice makes a man perfect. The next important reason why candidates fail PACES is confidence. Confidence should shine through your performance during your entire PACES examination. Your appearance, your examination skill, your presentation, your interaction with the surrogate and the examiner, everything, every moment should look slick and professional, as if you have done this thousands of times in your life. So fumbling, fidgeting, not sure of the physical findings, not able to communicate properly, not being confident in your presentation skills, these are the key reasons that make candidates fail in the exam, because they're not being confident. Alternatively, overconfidence kill as well, especially during your preparation phase. Be humble to the examination, never cut corners during your preparation time, and once you feel that you have mastered a skill, just practice that skill one more time. So, pro tip, try to strike the perfect balance between confidence, poise and humility. Lastly, luck. Luck does play a very important factor in your PACES examination. A certain center may have higher passing rate, a certain day may see a easier history station, or let's say a patient with all the good clinical signs fails to turn up for the examination, forcing the organizers to put up a more difficult case for the candidates. One of my friends in her neurology station spent 2 minutes of the precious 5 minutes trying to reorient the patient's position, as her bed was up against the wall and she struggled to get herself to the right side of the patient. She then spent the next 2 minutes of the remaining 3 minutes trying to expose the patient's leg, as the patient was wearing very tight jeans and it was impossible to pull up. You can imagine her agony when she only had just 1 minute left to do the entire neurological examination. She failed the station and she failed her exam. So there is really nothing much you can do about these things from before. It's important not to lose your calm, not to be argumentative towards the patient or the examiners. Keep your calm, improvise, try to think on your feet and make the most out of the situation that's in front of you. So pro tip, do good, think good and try to empower yourself so that you can face any situation that comes in front of you. That's it for today, guys. If you have liked this video, do give me a thumbs up and let me know in the comment section below how you found this video. Your comments and likes keep me motivated to bring more such up-to-date content in my channel. Thank you for watching this video. Stay safe, keep studying and ace your MRCP.